Hey everyone, it's Dr. Martin with Dr. M Live. It has been too long and school has started. So I'm excited to be here with you, and I'm sorry it has been as long as it has. But as I will explain, there's been a number of things going on in the field of pediatrics that have created this lull in my live broadcasts. And so we'll start there. So it has been very, very busy in pediatrics, and you're going to probably see more and more news articles and news reports about the state of pediatrics being sort of past capacity across our region and across the state. And so that's definitely created a great deal of stress on our part, and that's been for multiple reasons. So with the summer, we saw a huge load of patients needing forms, medical clearance to go back to school, vaccines with a new vaccine requirement for both the young and older kids. And so a lot of people didn't get checkups during that time as well of COVID. And so it was the first time they were getting checkups in a year and a half. And so we saw about a quarter to a third of our patients within about a month and a half requesting checkups. And it was too much for us to be able to see in such a short period of time. And so we're working through that backlog. We will continue to do that, but that wasn't it. So we also saw in June, as people started to unmask who were vaccinated, and we saw kids go back to daycare and things really loosen up. In July and August, we saw for the first time since the pandemic began a huge surge in viral illnesses in young children in our area and across the state. And so that included things like RSV, or respiratory syncytial virus, parainfluenza, which causes croup, as well as rhinovirus, which causes the common cold. And that really is not a common time of year for us to see that. It's usually wintertime, October to February. And so that was unexpected, but unfortunately happened at the same time. And so we're still dealing with the results of that across our state, and that's filling the hospitals and it's filling our practices. Compounding on that, schools are requiring medical clearance to go back. So once kids were in school, they had sniffles, it required medical clearance and testing to return to the school. And so that's created a huge burden of both testing as well as a need for visits in our office. And so that's where pediatrics in our state is right now. On top of all of that, across the state, we're actually experiencing shortages in the medical field, and pediatrics is not immune to that. I would say at Einstein, we're pretty lucky. We're still looking for a front desk staff member. So if you know of someone who's looking for a job and would like to work at the front desk, you can certainly have them send us a resume to see if that would be a good fit, because we could definitely use another person at the front desk. But we're pretty mild compared to most practices. Over 90% of outpatient peds is reporting staff shortages. In some places, there's more doctors than there are staff to support them. And that's not typical. Usually it's anywhere from 1.5 to 2 staff per pediatrician. And so that's creating a burden across the region as well. And so we have to ask for your patience. I know that it's, for checkups, we're seeing backups depending on when you're asking for that as far back as November. We're trying to get through that as quickly as possible. You will notice a new face in our office, Dr. Levy, who is filling in for May Ping, who's out on maternity leave. And she's been amazing. And I think you'll find her very lovely. And she is actually a colleague of Dr. Segura, who knew her from before from training. And so she was a known entity, and she was looking for a job as well, part-time. And so we were able to fit her in and for her to help us. So you're going to see her in the office as well. So we are trying to do things what we can to keep working through the patient volume that we're experiencing. We are still seeing same-day sick appointments, but particularly on days like Monday, that does tend to fill just because there's a huge volume of people from the weekend that call in. And so, in the situation where we're not able to get you in, we are triaging those and potentially sending them to the pediatric urgent care, PM Pediatrics usually, or to the pediatric emergency room at Inova. We know those sites are also getting pretty backed up, and the waits can be pretty long. So that's sort of our last resort. But there are situations that we cannot see any more patients in the office. Simply, there isn't enough time. And so we ask for your patience and understanding, and I ask you to be kind to our staff, because I know they may not be giving you the news that you want to hear, but we're all doing the best we can, and so we really need your help in making things continue to flow and work. So it's not all doom and gloom. There is a light at the end of this tunnel, and so you may have already heard that Pfizer is indicating that the vaccine for the 5 to 11 crew, the data looks good. They feel that it is safe, and they will be asking for emergency use authorization very soon. As I was predicting, somewhere in mid to end of September, because that's what they had said a long time ago, and they weren't veering from that schedule. So what does that mean for emergency use authorization? When might that happen? Probably your best case scenario is end of October, more likely into November, because it's going to take time for the FDA to review reams and reams of data to ensure that it is safe. Asking me if I would give it, as long as it's safe, I would, but I also haven't seen that data. And so we need to be able to pore over that as a medical community and ensure that it is indeed safe. But at this point, I don't think it's likely to not be safe. And so we'll keep you posted on that. We don't recommend off-label use. We'll continue to tell you not to do that. Wait until the emergency use authorization's here and we've reviewed the data, which will be very shortly. Now that brings another issue. I'm already telling you we're really exceeding our capacity in our office, and we have this backlog of patients. How is the COVID vaccine going to work for us as a practice? So I will tell you about 50% of practices in Virginia are stating that if they were asked to give COVID vaccine right now, they don't have capacity because of all the staff shortages and the volume of patients that they're seeing. Unfortunately, Einstein, we're in the same boat. And I don't think at this point we, as I had hoped, we are going to be able to safely give COVID vaccine in our office with the current patient volume and need to see sick patients. And so what does that mean? So I've been in contact with the Department of Health at Virginia. They are organizing mass vaccine sites, much like they did before. If anyone used the Tyson site, it was amazing. They were very efficient. It was very well done. And so we're looking maybe at that same site of having a mass vaccine site for folks that are needing boosters, but also children 5 to 11 that are going to need vaccination. Doesn't mean we're not going to give any vaccine in our office. It just means when that initial emergency use authorization comes, we can't give the hundreds of kids that are going to want it at that time. And I know you're going to want to get it as quickly as possible, as I would want to get for my child, and I would want for your child to get as quickly as possible. And that could just overload our phone triage as well as our staff. And so at this point, I'm going to be pointing you towards the mass vaccine sites. As the large number of people get it in the beginning and then the load decreases, I expect we'll be able to give small amounts in the office when people are doing checkups and those kinds of things. But I think that first month where there's a large number of kids wanting, we're not going to be able to do that. I will certainly let you know if that changes, but I don't see any help coming soon. I don't see the cavalry coming to help us get through all the testing needs, as well as checkups and visits and sick visits that we're needing to do. So I'm sorry for that disappointing news, but the good news is it really does look like we're going to get a vaccine for kids 5 to 11 really soon. And that actually will help all of us, because if your child's vaccinated, you won't have to go through this long quarantine period with testing. The kids are actually able to stay in the classroom. They will need some testing, but they can stay. And that is a big deal and a welcome relief for both families, probably employers too, that where you go to work, but also for us in pediatrics, so we don't have to test all those kids right away. I mentioned COVID testing being a pretty big burden for practices right now. It's not just us. You're going to see lines at the urgent cares doing this testing. And so we have certainly reached out to the state, both the governor's office and the Department of Health, to help with capacity for testing. I know that schools are being asked to take on some of this. There's $250 million of federal dollars that was committed to testing in schools. And so there are vendors out there. There are programs that VDH has put together to help schools do this. But I don't think you'll see that anytime before October. I do know that Fairfax County Public Schools is looking at vendors and looking to do this. And so we welcome that, because we need help in this testing. And so unfortunately, that probably won't occur much before vaccines for COVID start, which means we're not going to be able to do all of this alone. Sick appointments and well visits. We are probably backed up with well visits somewhere in November. So we are asking for your flexibility. We know we don't want to pull kids out of school for checkups But right now we don't have the normal flexibility like we did before COVID hit. So we are asking for your understanding and flexibility in setting up those appointments. We certainly have to prioritize checkups as well. So the younger babies and infants definitely should not go long periods or delayed periods without a checkup, as a lot's changing with them. Whereas older kids, if they're up to date with vaccines and there's no current issues, we may ask to push that back a little bit and ask for your understanding in that. Yeah, I think that's the news, guys. Excited. Keep looking to us for news about COVID vaccine. We'll try to keep you up to date. I will remind you that we are doing COVID testing in our office. We do both the point of care, which is the rapid test that you get within minutes. We can only do one at a time. So what we are usually doing is sending you home and giving you a follow-up call. It takes, I believe, about 15, 20 minutes for each test to run. So you can see how our testing capacity is somewhat limited. And so it does mean that you may wait a couple hours before we get your test run when there's a back queue of tests. We also do COVID PCR, which is definitely the more sensitive test. Particularly when there's been a close contact, we're going to encourage folks to get that. But it does take longer to get. We send those out to LabCorp. That's taking more like 3 days, it looks like, for us to get those back as more tests are the testing volume has increased. And so it is taking a little bit longer these days. If you do have questions, you can definitely put them into the comment section during the week. I will be looking there and answering those for you. If it's something more specific to your child or situation, we do ask that you reach out to the patient portal to send those. I will also say, if you have particularly during this busy time, non-urgent questions that you would like doctors and staff to address, the portal is a good way of doing that. We know that the wait times at certain times on the phone are longer, and I don't have extra staff to pull or hire at this point. So we do know that sometimes the wait can be 15 minutes on the phone based on the volume of calls, particularly on Monday mornings, end of day of Friday. Those are times that people tend to call in last minute, and the phones get backed up. And so if it's not an urgent need, I would request that you use the patient portal, where our triage team and doctors can answer there in a timely but more delayed manner. Well, I want to thank you for your understanding through all of this, guys. We will get through this. Vaccine's coming. I am really optimistic, but this is going to be a tough time, and we really need your support in this. My staff needs your support, and we will get through this. So please be safe, be kind, and we'll see you here next time. Take care.